All right, good afternoon, everybody. My name is Josh Jacobson. I'm managing director of Next Stage, a Charlotte-based consulting firm that works with nonprofit organizations and social good organizations to help them advance their mission. I'm pleased to be presenting the third of a series of 4 webinars on various topics. Today, we're going to be talking about human resources, sustaining your team during the COVID-19 pandemic. I want to thank the National Association of Free and Charitable Clinics and the North Carolina Association of Free and Charitable Clinics who are powering this webinar series. Advance to the next slide here. Here's a little bit about me. Like I said, I'm based in Charlotte. I've partnered with over 200 nonprofit organizations over the last 10 plus years. Many staff and board retreats conducted as a part of that decade, and of late, an increasing focus on clinics and community health. I've come to really appreciate what free and charitable clinics are and their role in community health. Our core service lines as a firm are strategic planning, organizational development, and resource development. And those topics came up quite a bit as a part of a project I've been doing with the North Carolina Association of Free and Charitable Clinics, working with both the state association as well as some clinics across the state through a grant that the state association received. And it was during that work with a number of rural clinics that the COVID-19 pandemic began to disrupt life for all of us. And being in the midst of strategic planning with those rural clinics, came to realize the topics that we were going to be discussing were being directly impacted by the current state of the world. So I thought to put together a crisis response workbook, the Free and Charitable Clinics edition, and shared that with the state association. And that led to these webinars. You see here that this is the third of 4. We actually had 2 last week, messaging and communications, developing your COVID-19 narrative, as well as financial resources, building your value proposition. And we had some great panelists for those sessions. We have a great panelist today for human resources topic, April Cook from the Lake Norman Community Health Clinic in Huntersville, North Carolina. Is going to be joining us in a little bit on this topic of sustaining your team at a time when many of us are sheltering in place, and others are, many clinics are considered essential workers, essential institutions. How are we taking care of the people that take care of others? As I've started every one of these sessions, that COVID-19 is really an opportunity for your clinic. And it's an opportunity for a number of reasons, as we've covered in messaging and fundraising. It's a great opportunity for you to be more visible in your community. It's also a great time to be raising money, despite the challenging economic conditions that are kind of current conditions across the country. Who has a better case for support than our free and charitable clinics at this time? Community health being such a top of mind topic for so many people. How are we capitalizing on that? Well, I'd argue it's also an opportunity for us to take stock of the people that drive our mission forward. In fact, as we go out into the world and talk about our case for support and why a community should support us and what our value proposition is to the community, we're often talking about our people. We're talking about our frontline staff, the folks that are building trust with individuals as they come through. We're talking about our providers, many different types of providers, whether volunteer or paid, but individuals who are often called to this work, called to serving the less fortunate. We're thinking about our volunteers, both our board members as well as our general volunteers, the people who are values aligned and driving forward our mission and unpaid in that activity. So these people are critical to how we function, and in fact may be the superheroes that we need to be placing in front of our community and lifting up. So today is really to talk about, if these folks are so critical and important to how we do what we do, how are we thinking and caring about them while this pandemic is going on. So let's talk about staff. Our staff are the lifeblood of a clinic. I've seen very large staffs in clinics. I've seen part-time. I've seen almost all volunteer staffing, and clearly our staff are how we get things done. And I've heard more than once one say that we're one diagnosis away from really having to close the clinic, because the person that sits in the front desk, or the executive director of our organization, we couldn't do what we do without he or she. And so how are we making sure that we are taking care of that person, making sure that they're physically healthy, but also their social and emotional well-being? This is a trying time for a lot of folks, and none more so than these courageous do-gooders who are frankly putting themselves on the line on a daily basis to advance that mission. There are opportunities here given these challenges. Our CDC protocols, which I know I would hope most of the folks who are on this call have implemented, social distancing, making sure you have strong signage and clear protocols. Many of you are engaged in telemedicine or have some sort of drive-through process that helps to keep your staff safe, putting them front of mind. One concept for consideration in this case would, have a retreat or even coaching for your staff, working through some of those social emotional issues. Have you asked your staff recently how they feel? Have you thought to wonder about what's happening at home for them? Because for many folks, this has also been a disruption to their spouse, to their children. I know the challenge of the homeschooling has been a real challenge for all sorts of folks. But also, if the other person at home has been furloughed, if a spouse is not currently working, how are these things impacting the well-being, the wellness of your staff team? And how are you asking those questions, but also having some solutions? Can you be more flexible to allow your staff to be able to perhaps work from home part of the time, if you are still open as a clinic? Are there opportunities for you to become more flexible in some ways? And ultimately, how is this informing going forward? How have we learned how working from home and working in more flexible ways creates more work-life balance that might, in fact, be an opportunity for your staff once COVID-19 is over? Thinking about our providers, knowing how many different types of clinics there are out there, and the different structures of how providers are brought forward. Of course, maintaining involvement. If you are utilizing volunteer providers, we have a kind of a challenge on both sides of the kind of practicing versus retired. I know for a number of the grassroots and rural clinics, it's that retired physician that you're hopeful to maintain licensure, and that person who is maintaining some engagement with you, that person may be unwilling to come into an environment where there's a threat. Older adults are the most challenged by COVID-19. So I know for at least one clinic that I'm working with in the rural areas, this is a real problem. Number of retired physicians who have noted, during this time, I really can't see any patients. On the other side, our practicing providers. These are often those volunteers who are working in the health system nearby. Many of them taxed, not all though. And we do know that there are some providers who are seeing fewer patients. Perhaps that's an opportunity as opposed to a challenge. Of course, some opportunities with our providers, the telemedicine opportunity. So many of our clinics have rapidly adopted and adapted to this environment with telemedicine, and I wonder how that might have an impact long term on your human resources. Is it possible for you to even have a provider engaged with you who isn't even in your town, who is a county over, someone who can continue to support even once COVID-19 is over? And ultimately, how are the provider challenges you might be having build your case for support? So for so many clinics, that case is based on volunteerism. Not in all cases. I understand there are going to be some clinics on our on this call who have providers who they are in fact paid providers. But how is the challenge that is in front of us right now building a case for support, a case for, in fact, paying a provider? If you've been reliant on volunteer providers, how would we make sure that there is no disruption, that your mission can be met? I know for at least one clinic that I'm familiar with, that's been on the table, wanting to kind of gird the provider support by hiring. So I wonder, for concepts for consideration, if there isn't a formal appreciation effort that we need to do. Our providers who've been in the trenches with us are essential workers right now. And we hope that when this is done, they come back to us. How do we show that we appreciate the volunteerism that they've been bringing to us for years? How do we show appreciation for them? Moving on to our general volunteers, these are the folks that we often are the beneficiaries of through relationships with Rotary or faith institutions, schools, and other volunteer groups. The fact is they're sheltering in place in many cases and have safety concerns for coming into the clinic. I'm sure you've heard from or have had to consider what your message is to these helpful volunteers who want to be engaged with you. Just there's a physical limitation to their ability to do that right now. These well-meaning folks, I wonder if there's not opportunities for virtual volunteering. What are ways that they can help your mission, help amplify and the visibility of your organization at this time? It's going to start with increased communication. If you haven't talked to your or written a communication to your volunteers recently, it may be time to do that. What we don't want is for them to not come back when we maybe go back to some degree of normalcy. Other organizations are finding ways to engage these folks who are sitting at home. As you can imagine, for many of us, me included, I'm kind of sick of my home. I've been here for 40 days now and probably have at least another month ahead of me. That boredom breeds innovation and opportunity. How might we engage some volunteers? So, one concept for consideration would be a face mask drive. Could we have some folks create face masks? We're talking about the cloth face masks that there are a number of YouTube videos for how to create. Encourage folks to sew those and then have those be distributed into the communities that you serve. There's, for the number of folks, the idea of a craft project right now would be a great one to feel connected to the cause. I'm sure you have other creative suggestions. This would be a really good brainstorming opportunity for maybe a staff team or even a board and staff combination. Speaking of board, there are a fourth group here, the challenge of meeting in person. A board is used to getting together and meeting on a regular basis, and they may be challenged to do so. There's also the decisions that need to be made. As we're going to hear from April Cook here in a moment, uh, there were some quick decisions that needed to be made in the early stages of this pandemic. But because there's so much uncertainty to the going forward, we need to keep our board close. There are going to be decisions that are bottom line serving, policy decisions, procedural decisions, that the executive directors and founders out there, it would be good for you to have some backup for those sorts of discussions, the opportunity to bounce ideas off of other leaders, and to get their good suggestions. So some opportunities here are video conferencing. We've certainly become a almost entirely virtual consulting firm. The webinar that I'm doing now with you is one of many webinars that we have been doing since the onset of COVID-19. Before the pandemic hit, we had never done a webinar in our lives, and video conferencing was a rare occurrence for us. Everything was done in person. And so for us to convert and pivot, the word of the year, pivot, into a virtual engagement platform, I can't say it was easy, but we did it. And the more encouragement there is for board members to engage one another virtually, there may actually be an opportunity to increase board engagement at a time where people can't actually be together. In some cases, our board members have nothing better to do, in part because they are stuck in their homes. Another opportunity here is to reach out to other organizations, for particularly board leaders to engage other board leaders. And that's really the concept for consideration here, would be a board chair focus group. As we talk about the social determinants of health and needing to weave together and create a network in our communities of health organizations, as well as social service organizations, human service organizations, how do our leaders know each other? And more often than not, they don't. Board members don't necessarily engage other board members. Executive directors do, program staff do, development directors do, but our board members typically do not. And so as multiple organizations are going to need to be thinking about, when do we open? When do our doors open? What are our protocols at various stages of the reopening of America? How do we deal with shortfalls in our budgets? What are other organizations planning with marketing strategy, with event strategy? I know for a fact many events have been tabled to the fall. Well, we can't have a whole year's worth of events all take place in a 2-month time frame and not have some downside. The same donors invited to multiple events. Well, that can be tactical engagement at the staff level. How are board members engaging other boards at this time? I could see this as a really great way to actually build bridges that we know we need to build for the social determinants work that we want to do now and into the future. So I'm going to encourage you to create a human resources plan. Add this to the other plans that we've talked about, the resource development plan and the messaging plan from our previous webinars. And, you know, engage them or lose them. That's our theme. If we're not taking care of the people that take care of us, we shouldn't be surprised that when things go back to normal, they're no longer with us. So how are we taking care of our staff team? What are a couple strategies that we could do to show our staff that we care about them, that they are meaningful to us? Will COVID-19 change how we're able to attract and retain providers? You know, we've already been talking about the kind of change in health policy that is disrupting many of our free and charitable clinics. There were already shifting trends that were potentially impacting the relationship that free and charitable clinics had with their health systems and the providers in those systems. I wonder how COVID-19 will disrupt what was already a changing relationship. What can we ask our general volunteers to help us with in the near term? We got to think about them and think about how we're going to find a way to keep them close. I know so many devoted, what I call lieutenant volunteers, those folks who almost function as a part of your staff because they can be counted on. Right now, they wish they could be with you. How are we keeping them engaged? And lastly, how do we invite our board members to be more bought in on decision making? I know many clinics out there have boards that are less engaged. You know, I think this is a symptom of something we probably need to address, which is how do we get more ownership of our free and charitable clinics by the governance system that is in fact responsible for it. Our boards, you know, our free and charitable clinics, 501c3 clinics are in fact owned by all people. We give them away to the world as public institutions. We draft board members to manage them on our behalf. And in too many cases, we have strong executive directors, strong founders who are more or less, informing direction, and the board rubber stamping that. Well, we are at a time where there's no one who has any answers to how best to do this. I don't know an executive director or founder or chief administrator out there who wouldn't jump at the chance to have an engaged board to walk through some of this stuff. So how do we actually use this time? And you know, we can wish for it or we can make it happen. So this is some of the backdrop that I bring forward. April Cook, executive director from the Lake Norman Community Health Clinic. I'm going to bring up the video panel. Hi, April. How are you doing?
I'm good. Thank you for having me.
Excellent. Thanks so much for being here with us. And I know we've worked together a couple times on different projects. I live right down the street from you in Huntersville. And so I was surprised to hear the story of your COVID-19 journey. So I want to speed that up and ask you how you've adjusted your clinic's operations during COVID-19.
Well, I was actually on a board meeting with the North Carolina Association of Free and Charitable Clinics when one of my staff members interrupted the meeting saying that they had a patient that came in that had just returned from China that had symptoms, flu-like symptoms. And so that immediately took us from 0 to 100. What do we do? And we need to make some decisions very fast. And so right after that, we decided to close the doors to the clinic, to patients coming into our lobby. And we instituted a telehealth protocols. Our state association has been fabulous. They were quickly up and running and getting all of those things in place for us to be able to conduct telehealth medicine visits with our patients. And we still see patients through a drive-through kind of event. They call us from their car or they knock on the door and we tell them to get back in their car, and we gown up, go out and find out what they need. And a lot of times they need their life-saving insulin. So we're still doing the things that we need to do with diabetic strips, insulin, over-the-counter meds, but we're also addressing some of the social determinants as well with grocery gift cards. We had a local foundation give us $5,000 to give out grocery cards to our patients. We also bought toilet paper for our patients because we knew they were having a hard time getting that very special resource. So we've been giving out toilet paper. So we're finding what we're doing proactively is making a difference. And I would say the single most important thing that we did in the beginning, even before we completely had the telehealth set up, is we started immediately calling all of our patients and telling them, hey, we're open. We wanted to try to alleviate fear. We certainly didn't want them going to the ER for medication refills or acute things that we could handle. And it was a welfare check. So we have a community health care worker on staff as well. And so she was checking on them. Are you working? You know, is anyone in the household working? What are your needs? Do you have any food insecurities, et cetera?
Yeah, good background and the swift acting. It sounds like you had your protocols and you put them into action very quickly. How has your staff dealt with this? I know you have a great devoted staff that you've grown. It's a small but mighty group of people.
Indeed.
How have they been through this?
Well, I think the most important thing that we did right up front is we have daily little huddles where they get the opportunity to express whatever's on their mind, whether it's fear. We kind of go through a checklist. How are the telehealth visits going? What's going well? What are some of the barriers? But we always end the day with a few minutes of gratitude, where each person can go around and just say what they feel that they're grateful for the day. But it also gives me a chance to say, how are you doing? How is your family doing? And because if we don't take care of our own, they're not going to be able to take care of our patients.
Yeah. Well, April, how are you doing? Do you feel the stress, or do you feel any amount of anxiety about this time in which we are?
I feel quite a bit of stress. And I think the stress is really the fear of making the wrong decision. Because not only do I have patients' welfare that I need to keep in mind, but I also have these staff folks. And I need to keep them safe because they're going home to families. So, just that stress of making that wrong decision or phasing things in too quickly or not doing something correctly and it really impacting someone's life or their family, it's a huge amount of stress that I feel that it's constantly going on in the background.
Yep. I'm sure many who are on this webinar feel the same stress.
Mm-hmm.
I know it's being felt through all sorts of social good organizations. As you know, we work with lots of different types of organizations, and it really is this uncertainty of, can we trust our instincts to make a decision? Every decision has ripple effects as to how it impacts the people that we serve. And I've seen so much heart come forward as a part of the decision making, because we know how much impact every small decision might have on someone's livelihood, on someone's life. It's pretty extraordinary. I wonder if you would talk a little bit about volunteers. You have a number of different types of volunteers. I know you have volunteer practitioners who come in. You have general volunteers. You have your board. Can you talk a little bit about sort of engagement of volunteers during this time?
Well, one of the things that we did very quickly is for volunteer clinical and office folks that were coming in to help us, we just said right away, we can't take that risk. Yeah. We're keeping the staff very small here, no more than 6 at a time. We only have 10, but we're not all here at the same time. Because that's one of the things I found early on is for them to feel engaged, for the staff to feel engaged, or to get them engaged, I had to give them a feeling of empowerment. And that empowerment was they got to be in the decision-making process. And so when we would sit down and talk about who do we want coming in, they were very quick to say, hey, I trust, and that's a big thing, trust. I trust each of you. I appreciate all the volunteers, but I trust you are doing the right thing when you leave this office, that you're not going to expose me to something. So I think that went a long way for our staff, again, to feel empowered, to be engaged, to make that decision. So right away, we said no volunteers are coming in to the facility. Now, if they call and want to know what they can do, we say, we would love lunch. And we've gotten lunch every week. So, if you want to help us, bring us lunch. We would love that. So we're doing little things like that. We're also telling volunteers, bring gift cards. Bring food gift cards. That's how you can stay engaged. That's how you can still make a difference. Because, let's face it, our population lives paycheck to paycheck. And so now they're really worried about putting food on the table. So that's another way that we get volunteers to feel engaged.
With telehealth and for your providers, has that been something met with any resistance, or has that been a fairly smooth transition for those you do continue to engage?
I would say it's not that it was super easy because there were a few challenges, but they were willing, and that's half the battle. They were willing to do it because they knew how important it was going to be able to provide these appointments, to, like I said, alleviate fear, to take care of our patients, to let them know we're open, we're still here there for them. So the willingness was definitely there, which is half the battle. Once we figured out a workflow, what the staff could do to queue up the patient, because it takes about 10 minutes to get them up and ready for a televisit. Now it's going very, very smoothly. We're seeing 19 to 25 a day through telemedicine. And, I think that's we're proud of that.
Yeah. Let's talk about your board for a bit. As I've worked with a variety of different types of organizations during COVID-19, what I've realized is how challenged boards can be to feel like they can add anything to the conversation. They feel dragged into their own challenges, their own work challenges. And so I've seen really strong executive committees or strong chairperson and executive director relationships, that kind of pairing with someone to kind of talk through. How has your relationship been with your board during this time? And how have you been, what platforms have you been using to engage?
So what we did, as soon as we made the decision, which was very quick, to close the clinic on March 18th, on March 19th, we had a board meeting. And we did it through Zoom, which was my first attempt ever to set up a Zoom call. And it almost was successful. It became successful, but I had a hard time getting on once everybody else, they had to wait on me for a minute or two. But
technical problems.
Yes. But once we were all on, it really went quite well. And I was recently on a webinar with a UNCC professor that his whole thing is how to teach people how to have successful Zoom calls. And one of the things that he just really kept saying over and over is keep them engaged. And if they're not talking, ask them a question. So if that's one thing I could share with everyone, if you are doing Zoom calls and you're looking at everybody and somebody is not participating, whatever, ask a question to that person, get them engaged, because we want everyone to feel not only engaged, but feel like accountable and responsible for the decision making for the clinic. And so we made some decisions right away. They were very supportive. I already had a plan to lay out to them, and they felt good about it. And so they check in on me probably on a weekly basis, someone from the board. So.
That's good. When you're well supported by your board, a time like now can feel maybe a little less intense or less scary. But we have to create platforms for the board. We have to encourage that engagement. So I love that suggestion to actually call on members during the Zoom call. It kind of wakes them up and keeps them alert to the topic at hand.
Yeah.
Well, April, you've shared so many good insights here. I wonder if there's any kind of final thoughts you might have, encouragement to the folks that are on this call around how to maintain a connection, that human level connection that is so much a part of the value proposition. What we hear from clients and patients is that this is a clinic that cares. They care about me. And that's often because the people behind the clinic care about each other. And I wonder, how do we encourage that? Any suggestions or encouragement to those who are on this webinar?
Well, first and foremost, I would say definitely stay on top of your website and your social media, because we're putting things out daily, updates. We're talking about the clinic, we're talking about successes, we're letting them know we're open. We've had the opportunity to be featured in 2 newscast stories during the news, which has been a great way to just amplify what free and charitable clinics are doing across the state. But the one thing that I do make sure that I say anytime someone is asking me about what we're doing and why we're doing it, and I think this is very important, is we're doing what we've always been doing. But right now, what we're doing is very critical, because we're keeping these patients out of the ER. Again, that's what we've always been doing. But right now, we're really keeping them out of the ER because of all the limited resources.
Yeah.
We want to save those for the critically ill. And so I stress over and over, we are a community partner. We're not just serving the uninsured. We're doing our part in the community to make a difference with the shortage of, again, resources and keeping folks out of the emergency room.
Yeah. Well, it's a great message. We talked about it as this has come through at every point in this webinar series. We talked about it in the messaging webinar and in the financial resources, how important it is to be communicating. And I think that the takeaway here for me is, that social media, that message out to the world, let's also keep in mind that we need to say that to ourselves. We need to say that to our volunteers and to our board members and to our staff even. We need to feel pride and a sense of accomplishment that we are actually flattening the curve and we are essential to where we are as a community. That will lift our spirits. That will keep us engaged. Well, thank you, April. I really appreciate you joining us, and I'm going to bring you back when we get to the end here. But I'm going to encourage folks to use the chat function. That is, if you have any questions you'd like to bring forward, we'll address those at the end. So in the Zoom chat, you can send a message to the panelists, and we'll address that. I'll keep going with some of the content that was in the workbook. So this is actually a physical workbook that I have my email address at the end if you are interested in it. Happy to send it along. We've made it available to all the clinics in North Carolina. It's also been shared up to the National Association. It's a simple workbook that can be an activation and platform for board and staff engagement. But on the topic of staff, many free and charitable clinics are on the front lines. And so, what are we doing to, plan for our staffing during COVID-19? And how do financial resources align with your clinic's ability to deliver on its mission? This is one of the challenges I see, there are many clinics out there that are being disrupted. Not so much because of the any earned revenue challenges, but more that the philanthropy that we would have expected. I know, as April will attest, she had an event coming up in May that had to be canceled, and that's a big fundraiser. So how will our staffing, in fact, be impacted by potential shortfalls in our budget? That's something we need to really think about and model, because no one can know. This is the challenge most organizations have. You can take stock of all the fundraising opportunities that are out there, all the grants that you receive. But we can't really know how the economy is going to impact our capacity to raise money, and ultimately how we can fund those essential staff roles. So while we talked in the last webinar, now is a great time to be raising money as a free and charitable clinic because your mission is front and center in the world. We have to make that true, and we certainly can't sit back and wait because others are raising those dollars, and I think we're going to have a negatively impacted philanthropic landscape in the months ahead. Secondly, how do various scenarios for the length of the pandemic and the local impact affect your staffing? So the reality is there could be many, many more potential patients for your clinic on the other side of this. In multiple states right now, there is 20% unemployment. And while many of those are furloughed workers who will be brought back in, what will the state of the economy lead to? How many uninsured individuals are there? There's a message out there in our own communities about how we are tying our healthcare to employment that is going to be very much dialed up in our communities. And so, if it does take a while, what if there is a flare-up? What if there is a second or third wave that will further challenge our community? How are we addressing it? What are we willing to do to the need that's out there? I want to encourage folks to come back tomorrow. We're going to be talking about strategic planning and the topic of taking a look at our financial position and then aligning that with the needs. So we'll talk about that a little bit tomorrow, but in the staffing plan, we really need to be thinking about this. As we think about volunteers, these individuals that contribute their time and talent to our clinics, it's important we stay in touch with them. Who are the key sources of volunteer support for your clinic? This may also be your key funding sources. If there's a tall steeple church in your community that is writing checks and sending folks your way, how are you engaging them? How are you keeping them informed? I know for many cases, houses of worship are, and those congregations want to be engaged in this crisis. They want to help, and finding your way in to connect with those congregations, volunteers who are sheltering in place, how are we engaging them? And how can people do that from home? As we've shared, there are lots of creative ways. As April said, gift cards and lunches. I love that. I love that your clinics, and I've heard that from multiple leaders, folks who've been highlighted as a part of this series, that, those lunches are coming. Well, that's an opportunity for us to highlight this local business function too, of keeping our local businesses in place. How else could we be doing that? What are the other businesses that are in your community that have a service that could benefit a low-income person, that someone going and donating or buying from that small business would both keep someone employed there, while also helping somebody who is impacted or has low income. That's a great kind of trifecta there of hitting the small business community as well as the folks that are in your constituency. And lastly, the board of directors, our governance. A lot of folks don't know. We ask. I think it's a beautiful model that we have our governing board, governance structures that are made up of volunteers, unpaid people who take on the responsibility of stewarding a nonprofit, but who has experience in a pandemic? Who would have experience to be able to navigate this alone? No one does. And in fact, our boards are often needing to be brought up to speed. If it's been a kind of sleepy time on our board and folks not paying attention, now suddenly we're being called to the front lines of this thing. How are we engaging our boards and making sure our boards are well informed and have the data that they need to make the decisions that are in front of them? How will they meet during the shelter in place? And what are those key topics? I bet you could even come up with a number of agendas for moving forward based on what you're experiencing. So I'm going to move on to our Q&A section and bring April back, because we have a number of questions in our chat window. That's nice that people have some questions for us. One question was, we're concerned about our older volunteers in their 70s and 80s who want to begin volunteering again soon, but it seems high risk for them. Any guidance? April, any thoughts on maybe some policies or procedures you might be enacting for your older adults?
Well, right now, like I said earlier, I really empowered my staff to make that decision, because if I have an expectation for them to be here, they needed to feel safe. And then I need to feel that I'm keeping as many people safe as possible. So they made the decision early on, no volunteers until the stay-at-home order has been lifted. And then we would reevaluate and talk about it
Right.
before we started letting people come back in.
Yep. And it may be that we are going to have to create new policies. I've worked with a lot of organizations, and if you have a kind of board handbook and you turn to the policies section, you kind of get a history of what has happened for that organization based on the unique policies that are there.
And I think you need to look, oh, I'm sorry. I think you need to look at the risk as well, because I don't think any of us want a story that a 70-year-old volunteer got COVID and passed away by volunteering at a free medical clinic. And so you kind of have to really evaluate that risk and reward. Find a way to keep them engaged, keep talking to them, let them know they're missed, and there will be a time when they can come back when it's safe.
Exactly. You know, sometimes we have to, you know, break some hearts in service to mitigating risk, and certainly you don't want to end up on the front page
No.
of any of any newspaper. But that might require you to have a new policy. I imagine lots of organizations are going to have new policies as a part of this because we might, in fact, have a second or third wave. We might address this again in the future. There may be future COVIDs that we need to be thinking about. And so I urge everyone to get with their board chair, maybe the governance committee or a compliance officer, or risk, someone in the risk function, and actually go back to some of your board policies. You know, what are some of those policies that are in place? And maybe we need to put some policies in place so that we are protected. So when that volunteer says, well, I'd love to volunteer, we can say, well, I'm sorry, but we have a policy voted on by our board. So it's not me telling you that, it's we have an
Exactly.
organizational policy. It helps you buffer a little bit there. A good question here, do you have any formal policies for working remotely? April, I know your staff is still working in the office, but you said there's some who are, you have 10 staff, but only 6 at a time. How have you treated the kind of remote working environment?
Well, so far everyone is working here. You know, the ones that aren't here are just off for the day. So we have
Gotcha.
not moved to that platform yet. I hope
Yeah.
we won't need to. So
Yeah.
far things are working well the way they are.
Yep. And I'll tell you about my own staff. So we have an office and it was closed. So we suddenly were thrust into a remote working environment. We created less policies than procedures. So much the same way April has a check-in on the front end of the day and on the back end of the day that we kind of take stock, compare calendars, make sure that we understand each other's needs. Certainly the challenge of folks who are having to you know, educate their children at home, you know, and I think we just have to embrace the unique nature of you know, a family that's having to wrestle with particularly younger children who are educating from a home environment. It is very difficult. I have a couple staff members who are challenged with this, and it's required us to have a very flexible attitude towards it. These are just the conditions, and it would be unfair for me to expect that would not disrupt my employees' work environment. So we've come up with flexible ways for each of our staff members to you know, report back to me, how will you overcome these challenges? You know, you tell me what you need. You might be working early morning or late night. You might need to take off 4 hours in the middle of the day because that's needed. It's not only for children, but caring for older adults. Many folks are sheltering in place with an older adult and needing to be there for them. So I think we have to approach this like we approach our patient engagement. We do it with heart. We do it with a desire to build trust and an appreciation, a mutual respect. So if we're you know, wondering and sort of too task oriented and worried that our staff is maybe taking advantage of us during this time, I wonder about the work environment that we've created for ourselves to begin with. So flexible and friendly is probably the way forward there. We have another question, April. How far back did you go in your records to contact your patients? They're a walk-in urgent care free clinic for uninsured. So did you have a policy as to how far back you went?
So what we did, we tried to think about it logically, that the people that had been to see us most recently, we wanted to start there. So we just took our calendar, our scheduled patients, and we started calling February on back. And so to let them know, because if they have been here recently, they're more than likely chronic disease patients, more patients that we definitely wanted to let them know that we were open.
Yeah.
So we went back a year with starting in February, working backwards from our schedule. Gotcha.
We have a question about accessing the recordings of the previous webinars. That's a great question. And I know Mark Shearer, who is tuning in here from the North Carolina Association, is going to be consolidating all of the webinars, so both the video as well as the PowerPoints, and those will all be made available I believe, on the North Carolina website. So look for that. You could also email me, which I'll get to that slide if you did want to engage. In fact, Mark noted that some clinic providers and staff are themselves in a high-risk category for COVID-19 by virtue of their age and health status. What is the best approach for handling folks like this who express reservations about serving? That's really an interesting question. We tackled it a little bit. What if you did have a provider who was a volunteer or retired volunteer? This is true in our mountain communities here in North Carolina, where we may have fewer active providers, but we do have retiree providers, and just the challenge of them not feeling comfortable. As April shared, the staff, they made a decision that no volunteers would come in. But I do wonder, until we have a vaccine, isn't it an active concern that any older adult might have for engaging? I wonder how we're going to address that, once the shelter in place is over. How will we wrestle with this until there is a vaccine? April, any thoughts on that? I know that's probably a bigger question, but what will you look to? How will that decision be informed?
Oh my goodness. I'll probably
I'm putting you on the spot big time, I know.
I'll probably listen to another one of the 50 webinars I have an opportunity to listen to on a daily basis, and hopefully glean some kind of insight. And maybe just checking with DHHS, other colleagues, and seeing what's working for them. I do think we should err on the side of safety and caution. But at some point, I know all of us want to return to as close to a normal work day as we had before this crisis. So I would just say, do your best to stay educated on what's going on in your own backyard, and what the state is saying, and locally and statewide.
Yep. Yeah, I think there probably needs to be a compromised immune deficiency policy for organizations. So how will you treat that for any staff or volunteer who, how will we make those decisions, and when do we hold firm, and when are we flexible? These are the big questions ahead of us, and I know we are not going to answer them all today. It is in fact not yet May, so we're still in April, and we still have some time to figure out some of these things. But April Cook, I want to thank you from Lake Norman Community Health Clinic for coming in today and so gamely joining this conversation for the tough questions.
You're very welcome.
Thank you, April. And again, like I said, we have a webinar portal that we'll be filling that Mark is going to be putting up, but he just noted too that the National Association is interested in posting these webinars as well. So I think we'll get really good distribution on this. And again, I want to thank April, thank the North Carolina Association, as well as the National Association for these supporting these webinars. Thank you for attending. We have one more tomorrow: Strategic Opportunities, Leveraging the Crisis for Change. That's at 3 p.m. Eastern Standard Time. And you see my email address there, josh@nextstage-consulting.com. If you'd like any of the links or content in between now and when the two associations will be sharing it, please feel free to reach out to me. Until next time, thank you and have a great day. Take care.